Hello, can all of you hear me, guys? Hello, can you hear me? Okay. Uh, so today we are gonna go strokes, right? Right. So today we are gonna do strokes, right? So Dr. Sumit asked me and some other people asked me that they have to do strokes because the strokes were not covered before, right? So I'm gonna start from strokes as well, right? It's a topic of neurology. So we are gonna complete the older topics before, right? After completing all of the older topics, then we are gonna move on to the new ones, right? Right. So what is stroke? The first thing that is important is what is a stroke, right? What is a stroke and why are the strokes important, right? The stroke basically means that there is damage to the brain, right? Basically, stroke means that there is damage to the brain, and that brain damage is now causing the
Hello, doctor.
now the brain damage is causing the body not to function properly.
Hello, doctor.
No, so we did strokes, right? I'm gonna teach you more about the types of strokes, right? What are the different stroke syndromes, right? What are the different stroke syndromes, right? Did we do stroke syndromes? No, you did not, right? So we are gonna do the stroke syndromes today, right? Okay. So the first stroke syndrome that is important is so these are very easy, right? They are not hard, and you do not need to worry about them, right? The first stroke syndrome that is important is the anterior cerebral artery, right? It's the anterior cerebral artery, right? So what if there is a stroke in the anterior cerebral artery? So basically, they, in the exam, they can ask you where the stroke is, right? What is the problem? So they could give you a lesion, right? They could tell you these are the signs and symptoms, and then we have to decide where is the stroke located, right? So the first one is the anterior cerebral artery stroke. So right, what is going to happen in the anterior but the stroke is that they are gonna give you a person, right? They are gonna give you a person and they are gonna say that a person comes to and the person is having weakness of the body movements in the lower limb, right? So if a person has weakness of the body movements in the lower limb, right? And urinary system is affected as well, right? Some urinary system and along with the weakness, there is sensory loss as well, right? So if there is weakness plus there's weakness plus sensory loss, right? And then it's present in lower limbs. And along with that, patient is having urinary issues, right? So urinary incontinence as well, right? So the first thing that should come into your mind is anterior cerebral artery stroke, right? So if they give you a set, a 65-year-old male comes to you. That male is a smoker. That male has hypertension as well, right? So the male has hypertension, a male is smoker, right? And all of a sudden, the patient is having weakness of left lower limb, right? So remember, the low weakness will be only on the one side, and the sensations of the left lower limb are gone away, right? There are no sensations of the left lower limb, and at the same time, the patient is having urinary incontinence as well, right? And then they ask you, where do you think the most likely the stroke is located, right? So most likely the stroke is located in the anterior cerebral artery, right? Most likely the stroke is located in the anterior cerebral artery, and that is why the patient is having these symptoms. Okay, is this clear, guys? Dr. Sumit, is it clear to you? Okay, the next stroke that we are gonna do is the middle cerebral artery, right? It's the middle cerebral artery, right? Now, for example, if again they give you a person and they say the patient is having weakness and sensory loss in the upper limbs, right? So in the arms, right? So if there is weakness plus sensory loss, right? So if your weakness and sensory loss, and that weakness and sensory loss is present in the upper limb, right? Then most likely the stroke is gonna be a stroke of middle cerebral artery, right? You just wanna see the patterns. What is the pattern? Where is the stroke occurring? And from that, a lot of things are gonna be clear. Right? A lot of things are gonna be clear, right? So if there is weakness and there is sensory loss in the upper limb, right? So most likely, again, this is a stroke of the middle cerebral artery, right? But if there is weakness in the lower limb along with that, yeah, there is urinary issues as well, then the first stroke is going to be anterior cerebral artery, right? Now, if they give you a patient and they say that this patient is only having weakness of a particular limb, right? This only weakness, right? So only weakness is present of the left upper limb or the left lower limb, right? Then what is the most likely stroke that comes into your mind, right? Then this stroke is known as a pure motor stroke, right? This is the third type. Remember, now if the stroke only involves motor system and it does not involve. So first of all, if the stroke involved both motor and sensory system, right, and it was present, um, right, in upper and lower in lower limbs, right, and there was urinary incontinence, right, then obviously the stroke was the stroke of anterior cerebral artery, right. And if motor weakness and sensory loss occurred in the upper limb, then obviously it was a stroke of middle cerebral artery, right. And if the stroke involved lower limb only motor signs, right? So there was contralateral weakness. So we are going to get into the contralateral weakness, right? So if there is only weakness of movements, right? If there is only weakness of movements, right, then the stroke is going to be a stroke of the lenticular striate arteries, right? Then the stroke is going to be a stroke of lenticular striate arteries, right? Right. No, there won't be any other symptoms. No sensory loss is gonna be expected, right? It's a pure motor stroke, right? And it is also known as a lacunar stroke, right? This is also known as a lacunar stroke, and it's a pure motor stroke. This is important, right? So this is lacunar stroke, right? And we also called it as a pure motor stroke as well. So these were the three main strokes that we did, right? So these were the three main strokes, right? Please tell me if you have any questions regarding this. If not, then we are gonna move forward. Okay. So do you have any questions? Yes. So the small perforating arteries are basically lenticular striate arteries, right? The small lenticular striate. What's the full name? Lenticular striate arteries, right? This is the full name. These are the small perforating arteries, the lenticular striate arteries, right? Just keep these in your mind, right? Lenticular striate arteries. Yes, we are gonna go to the posterior cerebral artery as well, but first of all, I wanted to clear these up, right? I wanted to, I wanted to clear these things up, right, and then move to the next one, right? This okay. Now, one other thing that is important is that in case of anterior cerebral artery stroke, what area of the brain is affected, right? What area of the brain is affected? This is asked a lot. What area of the brain is affected if a patient is having anterior cerebral artery stroke? Right? What area is affected? Well, so the medial part of the brain, right? The medial part of the brain is affected, right? The inner side of the brain is affected in case of anterior cerebral artery stroke. Whereas in case of middle cerebral artery stroke, the lateral side of the brain is affected, right? Right. So these are two types, right? The lateral brain is affected in the middle cerebral artery stroke, whereas in the anterior cerebral artery stroke, the middle side of the brain is affected. I hope that's clear to you guys, right? Now, now we are going to move to the posterior cerebral artery stroke. How is the patient with posterior cerebral artery stroke gonna present to you, right? How does the patient of posterior cerebral artery stroke presents to you? So remember, if a patient is having a stroke of the posterior cerebral artery, that patient is now gonna say to you, I cannot see anything. Right, the patient is gonna have basically two things. The patient won't be able to see from one eye, so maybe from the left eye. So if the right-sided posterior cerebral artery is affected, the patient won't be able to see from the left side. If the left middle posterior cerebral artery is affected, obviously you won't be able to see from the right side. Okay, along with that, you're gonna have another thing as well, right? So obviously the patient won't will be able to see from the other side, but the patient will have a condition which is known as prosopagnosia, right? The patient would have a condition that is known as prosopagnosia, right? Patient is going to have prosopagnosia. What does prosopagnosia means, right? So prosopagnosia basically means the fact that you would be able to see someone, right? You would be able to recognize see someone, right? But won't be able to recognize familiar faces, right? You would be able to see them, but you won't recognize, right? How can this come to you in the exam? So this could come into exam in this way. So for imagine they could give you a 30, 45-year-old male, and that 45-year-old male comes to you, and that male again is a smoker and hypertension, right? Why do I say smoker and hypertension many times? I says no. So it's what? So contralateral, right? Contralateral vision is gonna be affected, right? All of these strokes they affect the contralateral side, right? Right now we are talking about the contralateral side. So if left side of the body is affected, right? Right. If left side of the brain is affected, right side of the body is gonna get weak, right? In case of a deep cerebral artery stroke. If left side of the brain is affected, right side of the upper body is gonna get weak in case of middle cerebral artery. Similarly, if left side of the basal ganglion, left lenticular striate arteries are affected, right there would be the main problem is gonna be a right-sided weakness, not the left-sided weakness. Right now, if the left posterior cerebral artery is affected, the main thing that you're gonna see is that the patient won't be able to see anything, right? The patient won't be able to see anything. This would be the main thing that the patient is gonna have, right? And at the same time, the patient would have an inability to see a recognized person, right? The patient would say that I'm sorry, I cannot recognize this person, or the patient won't be able to recognize his father as well, right? So this is posterior cerebral artery stroke. Right? Now we're gonna move on to the next one, which is the basilar artery stroke, right? So now you're gonna move to the basilar artery stroke, right? Now what does basilar artery affect? So basilar artery is basically gonna affect the pons, right? It's mainly gonna affect the pons. Yes, he can still see with the other eye, right? But when he will see with the other eyes, he won't recognize patient. He would see a patient, he would see his father, he would see everything regarding his father or his wife or his children, but he would ask everyone, who is this person? I cannot recognize this person anymore, right? This is the main thing that the patient is going to have. He would be able to see, but he won't be able to recognize. Yes, this is known as visual agnosia, or we call it as prosopagnosia, right? Now when the what now we have another artery which is known as the basilar artery, right? We have another artery which is known as the basilar artery, right? So what does the basilar artery do, right? So basilar artery is very important because when the basilar artery gets damaged, you are gonna get a stroke of the pons, right? You're gonna get a stroke of the pons. Now what is gonna happen in the case of basilar artery damage is that when the pons is gonna be affected, right, you're gonna have quadriplegia, right? You're gonna have quadriplegia. So all four limbs are not gonna move, right? So if they give you a person and they say all four limbs are not moving, right? All four limbs are not moving at the same time, right? Now, what is the first thing that comes into your mind, right? So the first thing that should come into your mind is basilar artery damage, right? So it's it's gonna be a basilar artery damage, right? Stroke is gonna be a pontine stroke, right? The stroke is gonna be a pontine stroke. Mhm. Okay, guys. Now the only movement so this is important. The only movement a patient can do in case of a pontine stroke is the patient can only do vertical movements of the eye, right? So the only movement that would be possible in case of a pontine stroke is gonna be vertical movements of the eye, right? It's gonna be vertical movements of the eye, right? These are very important, right? And the patient would only be able to blink vertically, right? So only eyes are gonna blink. Mm. Right, so now they could give you a question there. Or someone comes to you, this person was again smoker and hypertensive. Why I'm telling hypertensive and smoker again and again, because this is how normally patients of stroke present you. And now all of a sudden this patient cannot move anything, right? The patient cannot move anything, right? And all no movement of the body is occurring, right? And the only movement the patient can do is vertical movements of the eye, right? Only the patient can only blink, right? And then they could ask you what is the most likely diagnosis. The most likely diagnosis is going to be a basilar artery stroke or a pontine stroke, or we call this as the locked-in syndrome, as Dr. Sumit just told us, right? So the last thing is the patient could be having locked-in syndrome as well, right? Very good, Dr. Sumit, right? So this is what you're going to have in case of a pontine artery hemorrhage, right? Now we have three other arteries. One is the ICA, right? The other is the PICA, right? So ICA stands for anterior inferior cerebellar artery, and pica stands for posterior inferior, so cerebellar artery, right? So this is pica. So pica means posterior inferior cerebellar artery, right? And ica means anterior inferior cerebellar, right? So how is gonna how does a stroke of ica presents you, right? Now in case of ica stroke or anterior inferior cerebellar artery stroke, right? You're gonna get a lot of problems, right? You're gonna get a lots of problems, right? What are the problems that you're gonna get in case of ICA? So let's first do ICA, right? Okay. So are you with me here, right? I hope so. Yeah. So this is also known as the lateral pontine syndrome, right? ICA stroke is also known as the lateral pontine syndrome, right? We would go into the detail of the anatomy later, but if you see those pons, right? Pons have two areas, right? If this is the pons, right? Pons have two areas. This area is known as the medial area of the pons, and this area is the lateral area of the pons, right? And the most important area of the pons is the medial area of the pons, right? The medial area of the pons is the most important area because here all of the movement things are occurring, right? Whereas in the lateral area, the movement things are not occurring, right? So now if they give you a person and they say this patient is having, first of all, no sensations, right? No sensations, no contralateral sensations, right? And the patient is having ataxia as well, right? The patient is having ataxia as well, right? The patient is having facial weakness as well, right? And the patient, so basically these are the main things, right? These are the main things. So no sensations, ataxia, and facial weakness. What is the most likely diagnosis? The most likely diagnosis is going to be an ICA. ICA stroke. So anterior inferior cerebellar artery is affected in this stroke, and this is what most likely is happening in this case, right? This is known as an ICA stroke. So remember, whenever a stroke says that the facial artery is affected, right? Facial artery is affected, right? Then the first thing that comes into your mind should be an ICA stroke or the lateral pontine syndrome, right? Now, let's move on to the pica stroke, right? Pica is also known as a posterior inferior cerebellar artery. So, in case of a pica stroke or posterior inferior cerebellar artery, the first thing that the patient is again gonna have, patient is again gonna have, let me write it, right? So again, there is gonna be no sensations from the contralateral body. The patient is gonna have again ataxia as well, right? But the third thing with ataxia is that facial nerve is not gonna be affected. The nerve that is here gonna be affected here is the vagus nerve, and you are gonna have dysphagia and hoarseness of voice, right? So now you're gonna have dysphagia, you're gonna have hoarseness of voice, and the gag reflex is gonna be reduced, right? So remember, if there is no sensations, if there is ataxia, if there is nausea, if there is vomiting, right, all of those things are occurring, right? And at the same time, the patient is having dysphagia, hoarseness of the voice, right? So the first thing that should come into your mind is like the what do you say? Pica stroke, right? So this is the difference between pica and ICA stroke, right? So now, Dr. Samit, is any stroke, is there is any this there is any other stroke that you want to that you want to do? So we have covered all the strokes, right? No stroke is left behind. Believe me now, if any stroke comes into your exam, if any single stroke comes into your exam, you would be easily able to do it, right? You would be easily able to do all of these strokes, right? Right. So anterior spinal artery is not important. They are not going to give you anterior spinal artery in the exam, right? That one is useless, right? So that is why they did not cover it, right? So that is why I did not cover anterior spinal artery. It's gonna confuse you more. It's not important, right? So there are some other strokes as well, but they are not important. These are the ones that are important, especially they want you to know what is a pure motor stroke, right? What is a pure motor stroke, right? So again, I am asking you, oh, if only motor supply is damaged, if this patient is only having motor weakness, then what is the first thing that should come into your mind? Anyone, guys? Yes. So lenticular striate arteries, right? Lacunar stroke, lenticular striate arteries is gonna be affected in case of that stroke, right? Now let's move to some other things. Let's move to some other things as well, right? Let's just end it, right? Right. So basically, we have a thing which is known as a C5, C6, which is the upper trunk. So we have a this upper trunk which is known as the C5 to C6, right? If this upper trunk C5 to C6 gets tractioned or teared, right? So how can this get tractioned or teared, right? So if a patient is having a neck trauma, right? Or so if a patient is having a neck trauma, so you can have neck trauma in two ways, guys, right? So you can have neck trauma if you are riding a bicycle or a car, right? Or if you fall on your head, or at the same time when a baby is being born, right? We put a lot of pressure is being put on the baby's neck, right? When a baby is being born, a lot of pressure is being put on the baby's neck. So if a baby is being born and a lot of pressure is being put on the baby's neck, then you are getting this problem, then you are getting the Erb's palsy, right? Or so this is known as the Erb's palsy, right? This is known as the Erb's palsy, right? So how could they give you this question? They could say that a person comes to you and that baby was being born and the delivery was very difficult, so we use instrumental delivery, right? So we use instrumental delivery, and obviously when you're going to use instrumental delivery, you're going to put additional strain on the neck. Now, what are the signs and symptoms? So first of all, the patient is going to say, right, the hands are going to be in adduction, right? Right. So the hand, so this is also known as the waiter's tip, right? So they are gonna say that the baby came to you and the baby is having hand in adduction, right? And it's medially rotated, right? It's medially rotated, right? And it's extended and pronated, right? Just like how a waiter asks for a tip, right? And it is extended and it is pronated as well, right? It's extended and pronated, right? So this is how they are gonna give you a question of Erb's palsy, right? They are gonna say to you that a person comes to you that that person's arm is being held in adduction and it's medially rotated and it's extended and it's pronated, right? And then they're gonna ask you what is the most likely nerve root that is affected in this case, right? So the most likely nerve root that is gonna be affected is the C5 to C6, or it's gonna be the upper trunk, right? This is known as the Erb's palsy. It usually happens in kids. And what is the most likely prognosis in kids? If this thing happens in kid, and they ask you what do you think will like most likely happen in the future with this kid? Would it get better? Would it get worse? Would the patient have permanent functional deficits? What do you think? What would the most likely answer be? Anyone? Anyone, guys? Okay, so the most likely answer is that it's gonna get better, right? You do not yet. So in case of a birth trauma, right? So if a patient is having a birth trauma and that patient is having this palsy, right? The patient is gonna get better, right? That palsy usually resolves on its own in children, right? It's gonna resolve on its own in children, right? This is the first palsy that is important. The second part is the Klumpke's palsy, right? Klumpke's palsy is very simple, right? Klumpke's palsy happen when you damage C8 to T1, right? This is the lower trunk, right? So again, if upper trunk is damaged, you are gonna get a palsy, and in a palsy, the hand is gonna be adducted, the hand is gonna be medially rotated, right? The patient, so the hand is gonna be adducted, the hand is gonna be medially rotated, right? It's gonna be extended as well, right? So these are all of the things that you're gonna have now. Why does this happen? Again, in children, it happens during delay. So how do Klumpke's palsy occur? Klumpke's palsy usually occurs in children whenever they're being born, right? And they can occur. Yes, so sure. So the Klumpke's palsy is gonna affect the C8 to T1, right? Klumpke's palsy is gonna affect the C8 to T1, right? It's gonna affect the lower trunk. And why does this happen, right? Why? So this happens when a person is grabbing something by his arms, right? So the person grabs a tree while falling from somewhere, right? So imagine you were standing on top of a tree and all of a sudden you fell, and when falling, you suddenly grabbed a tree, right? Then your brachial plexus or the lower trunk of the brachial plexus is gonna be stretched and you're gonna get Klumpke's palsy. You're gonna get Klumpke's palsy. And what would be the features? It's very simple. Just remember, there's gonna be claw hand. That is all. You're gonna have a claw hand in this patient. Right, so two palsies. One is Klumpke's and the other is Erb's palsy. And Erb's palsy, the upper trunk is affected, whereas in Klumpke's palsy, the lower one is affected. Right. This is the difference between these two. Right. This is the difference between these two types. Anyone, any question? Any questions, guys? Okay. Now we have a nerve which is known as the femoral nerve, right? What does the femoral nerve do? The femoral nerve has three or four main functions. First of all, it causes leg extension, right? It causes the legs to extend, right? It causes the patellar reflex as well. I think we have done this before, but I'm repeating, right? It's gonna supply anterior thigh and sensory as well. So it's gonna do the anterior thigh sensory supply, right? So now if they give you a question and they ask you, a patient comes to you and that patient had a pelvic fracture or a pelvic trauma, and So ulnar nerve is gonna go claw hand as well, right? So there are different causes of claw hand. One of them is ulnar nerve injury, but Klumpke's pulse is gonna cause claw hand as well. Ulnar nerve claw hand is different when we do ulnar nerve. I'm gonna tell you about that, right? So femoral nerve, right? So when if they give you a person and they say that the patient's leg extension is not working properly, right? And the patient's patellar reflex is gone as well, right? And there is a sensory deficit in the anterior thigh, and then they ask you what is the most likely diagnosis, right? So the most likely diagnosis is going to be a femoral nerve injury, right? So the most likely diagnosis is going to be a femoral nerve injury, right? And this is very important. Okay, any questions, guys? Now, the next nerve that is important is the lateral femoral cutaneous nerve, right? So you won't see, oh, you will, maybe you would see that this nerve is not important, but believe me, I cannot tell you how many recall questions that I saw on this nerve, right? So only on this nerve there were thousands of questions, right? So lateral femoral cutaneous nerve, right? So what was this nerve and how does this nerve, how do this nerve function, how do this nerve works, right? So in lateral femoral cutaneous nerve, what is going to happen is that this nerve is going to be affected, and when lateral femoral cutaneous nerve gets affected, what are you going to happen is that you're going to have decreased sensation of thigh, lateral thigh, right? So there is going to be decreased lateral and anterior thigh sensation, right? Now, why is this thing important? This thing is important due to the fact that this thing happens usually in people who are very obese or which do tight clothing. So obesity, tight clothing, and pregnancy, right? Okay, now when this happens, the patient is gonna have a condition. Okay, first tight clothing. Now the patient is gonna have a condition which is known as the meralgia paresthetica, right? The patient is gonna have a condition which is known as the meralgia paresthetica. You're gonna have meralgia paresthetica. And in this condition, right, in meralgia paresthetica, the patient is going to be fat. So they are going to give you a 30 or 32-year-old female, and that female is going to be obese. And now the female is going to see, I am having some tingling. The patient is going to say, I'm having tingling, numbness, and burning. So the patient is gonna have tingling, the patient is gonna have numbness, the tingling patient is gonna have burning as well, right? So these are the things that is gonna happen in case of meralgia paresthetica, right? And where do all of these things are gonna occur, right? All of these things are gonna occur in the anterolateral thigh, so the anterior and lateral part of the thigh. All of these things are gonna be affected, guys, right? Is this clear? Anyone? Is any questions, right? So believe me, these are the things that I'm covering from myself, right? These are all of the things that I'm covering from myself, right? Because I want you guys to succeed in the exam, right? Believe me, guys, you would meet a lot of tutors, you would meet a lot of mentors in your life, right? And everyone would want to get as much money as possible from you, right? So I'm not getting paid, even paid for these, right? So I'm only gonna get paid from the next gen for the 40-60 lectures, right? So anything that I do beyond the 60 lectures, so these are the extra lectures that I am doing on my own behalf, right? So why am I doing these lectures? I am doing these lectures so you get the maximum amount of knowledge, right? And you do not get any question wrong in the exam, because I have been in your shoes, right? So I want the best for you. Okay, so I am sorry for what happened in the past days, right? I'm very sorry, right? Now, believe me. So let me finish. So okay. So I'll show you this as well, right? So basically, let me show you these, right? So guys, this is all of my stuff, right? So when I go to the work, this is everything. I haven't even figured out to put everything yet in any place, right? So this is everything, like this is how I am living for the last 3 or 4 days, right? And I don't did not even get the time to put everything here, right? So this is everything, right? So this is how I am living right now, right? And the only thing that I have in the fridge as well are these 3 or 4 5 things, right? These are the 3 or 4 so things that I am having, right? All these are all the things that I'm just having, right? So I'm going, so that is why it's sometimes hard for me right now to take the class, because the things are in not proper order, right? I have ordered the internet for myself as well. I do not have the internet as well, right? So this is why the things got delayed a bit, right? So that's now let's move to the next topic, right? So thank you so much, everyone. Okay, so now the next topic. So the most important nerve in lower limb, right? Again, I'm telling you the most important nerve in lower limb, which I believe are four nerves, right? So one is lateral femoral cutaneous, the other is the femoral nerve, right? And now they are gonna give you again a question that a female comes to you, that female is fat, or that female is pregnant, right? Or that female is post pregnant, right? And now the female says that I am tingling and burning sensation in the upper outermost portion of my thighs. They are not gonna say anterior and lateral because they are clever, and they know you what and they know, so they are gonna switch it up bit, right? So they are gonna say the patient is having problem in the outermost portion of the thigh, right? So this is what a patient, this is what they are gonna say. The patient is going having problems in the outermost portion of the lateral thigh, right? So this is what is gonna happen. And so again, this is what is gonna happen in case of like what do you say? The lateral cutaneous nerve problem, right? This is known as the myalgia paresthetica. Now we have the two most important nerves, right? Two most important nerves of the body that are very important. So one is the common peroneal, right? So the first one is the common peroneal, right? And the other one is superficial peroneal. Okay. So one is the common. So from common peroneal, two branches come, right? So from common peroneal, two branches are gonna come. And what are those two branches? So those two branches are known as the one branch is known as the from the common peroneal, one branch is known as the superficial peroneal nerve, right? So one branch is known as the superficial peroneal, right? And the other branch is known as the deep peroneal nerve, right? So you're gonna have two of these branches, right? Now we are gonna see how each of these branches work, right? So we are gonna see how each of these branches work, right? So is that clear to you guys? Now, what is going to happen in case of superficial peroneal nerve injury, right? So now they are going to give you a person. They are going to say that a person comes to you, and that person is having, right, foot drop, right? First of all, they are going to say foot is going to be dropped, right? So in case of superficial peroneal nerve, the foot is going to be dropped. This is the first thing that is going to happen, right? Now, here again, foot could be dropped, but so how do you differentiate between these two nerves, right? How do you differentiate between the superficial peroneal and the deep peroneal? So remember, it's the sensory supply. It's the sensory supply that differentiates between these two, right? The sensory supply is the one that differentiates us, that let us differentiate between these two conditions. How? Because in case of deep peroneal nerve injury, right, the sensations between the first toe and the second toe are gonna be gone, right? So sensation between the first and second toe are gonna be gone in case of superficial deep peroneal nerve. Whereas in superficial peroneal nerve, the dorsum of the foot is gonna be gone, right? Ex- right, except this area, right? Now, if they give you a person, they say that this person comes to and that person is having foot drop, and at the same time, sensations of that person is there are very reduced sensations, and that reduced sensations are present between the first and second toe, right? So, what is the first thing that should come into your mind, right? Anyone? Yep. Anyone? Yep. So it's gonna be the deeper onion, right? It's gonna be a deeper onion, right? And if they give you a food dropper and they say that this is the food drop. Yeah. So deeper onion, right? So okay. So any questions till now, guys? Any questions, guys? Okay, so the next of the nerves, right? We are gonna do in the next lecture. So we are gonna do the rest of the nerves along with the skin topics, right? Next, right? And then we are try to finish everything, right? So if you would have any topics that you think are left behind, just get me know in the group, right? I would share those topics as well. And the other thing that is important is I'm gonna share all of the Q bank today, right? So all of the Q bank is gonna be done today, and I'm gonna show that Q bank with you as well, right? So that is gonna be shared. Yes. Okay. So the thing regarding the lectures are Dr. Hamza handles all of those lectures. So what I'm gonna do is right within 1 or 2 days, right? As soon as I get my yes. Yes, so I'm gonna take the lecture control into my hand as well, right? So I'm gonna upload the lectures myself from now, right? And when I do that, that thing is gonna be fast. So let me just ask Dr. Hamza, how does he like do that, right? So I'll tell you. Okay. Yes, yes, I get your point, right? So I'm gonna take the lecture control, the YouTube into my hand, and then I'm gonna go do it myself, right? Okay. Yeah. Okay. So take care, guys, and bye bye, right? Okay. Bye bye.